First of all, thank you ever so much indeed for taking the time, busy day, to talk to us today.
Oh, it's an honor to be with you. I'm really honored to be able to introduce the Vice President this afternoon, and I had a chance to work with him on the Mental Health Parity and Addiction Equity Act, which I sponsored in the House, and my father was the sponsor in the Senate, and Joe Biden was a great supporter of ours all along the way. And then, of course, he was in the administration and helped us get it into the ACA, the Affordable Care Act, and that was critical to really making the progress of parity go even further. And then, of course, he helped us get the final rule, and now it's appropriate he's here today because we need his help in seeing the law finally implemented and enforced. So the key to the law is you treat the brain like any other organ of the body. So if diseases of the brain need to be treated like diseases of the heart or the kidneys or anything else, then they need to be paid for. Well, the key to what's going on here at the APA is that you can have all the best treatments in the world, but if they're not paid for, the people can't benefit from them. So that's why Joe Biden is so critical to this process, because we need to enforce the law which will require payment for the services that this convention is dedicated to providing.
If we went to, which is great news, the Vice President is here today, as you say, but if we were to go back a year since the last time we met, 166th conference, what progress has been made legislatively in getting this stuff done?
Well, as I said, we're moving forward rapidly. The expectation that insurance companies are now going to be required to provide equal coverage, inpatient in-network, outpatient in-network, inpatient out-of-network, outpatient out-of-network, pharmacy and ER. I mention that because we're specific in the law that if you treat diabetes with primary care and preventive care, you need to treat mental illness the same way. If you treat chronic illnesses like asthma, then you need to treat chronic illnesses like mental illness the same way. And we don't wait till someone has to have their legs amputated because that's the way we reimburse for diabetes care. We don't reimburse for diabetes care, but it is the way we reimburse for mental illness. We wait until you have a crisis before we trigger the reimbursement mechanisms. What we now have is the law that will require that to change, but it will only change if we enforce the law. And the only way to enforce the law is to know whether it's being adhered to, and you can't know if it's being adhered to if you don't have transparency and disclosure by the insurance companies about how they make medical necessity determinations. That's where the action is.
So how do we get that done then? Because if the law has taken us this far, and it's actually the Parity Act, as you say, and we've got down the road to where we've got to, but you're saying that's no good if we don't actually know what's going on, then what do we do now?
So you can either go the nice way or the not so nice way. You can sue and litigate and have a body of case law begin to establish what the parameters are. That would take years. Or we can work with our insurance friends and say, listen, what are you thinking about covering? Why? What are the best practices in this field? What are the standards? Work with the consumer community in terms of what do you want? Because guess what? It's not simply about providing the service. It's providing the service that's going to help the person struggling be able to reduce their symptomology and lead productive lives in recovery. So we can't think about this just in the micro. Is this reimbursed or that reimbursed? Is the package of services reimbursed such that the patient benefits in an optimal way? So that's talking about a lot, but what it means is we need to engage in a discussion as to what it is that we want mental health to be.
But you raise an interesting point there, engage in the discussion, because one of the things that I've noticed in the last year is the high visibility that the APA and other lobbyists have had to take in this field. You've actually had to have this conversation in public.
Yes, and it's good. I think that the liability, of insurance companies to now provide this benefit means they're scrambling. So what they could really benefit from is the knowledge and expertise about what's working out there to reduce the mortality and morbidity of those suffering from mental illness. The costs are enormous, not only in lives, those that are in our prisons and jails, those who are homeless, and of course those who are in emergency rooms. So the key now is, how do we spend that same dollar, because we're spending a lot of it, but reappropriate that dollar in a way that keeps people out of the jails, out of the ERs, and living productive lives? Because I think we have the dollars. The question is, how do we spend those dollars to get the results that we want?
Well, Congressman, thank you ever so much indeed for talking to us today.
It's a
really
pleasure.
appreciate it.
Thank you.